Hello everyone and welcome to the video lecture titled Combining Oral Dutasteride and Spironolactone, Management of Androgen-related Conditions in Males. In this video we will carefully analyze both of these oral medications, their efficacy at different dosages and effects on the androgenic load. We will try to determine what changes in androgen-dependent processes like body hair growth, scalp hair loss, hormonal acne, etc. can be achieved while on treatment with oral dutasteride and oral spironolactone. We will also look into safety and how to minimize side effects and balance the risk-reward ratio by adjusting the dosage. The main reason I'm doing this video is because I believe oral spironolactone to be a massively underrated treatment. When stacked with dutasteride, I believe it can provide a very strong systemic protection against androgens without an overly large risk for side effects. So, let's dive in. First, let's look into dutasteride. So dutasteride is a potent dual 5-alpha reductase inhibitor that dramatically lowers DHT. In men taken 0.5 mg a day, which is a standard dose, serum DHT falls by upwards of 90%, often by 95 to 98 even. For example, finasteride, which is another 5-alpha reductase inhibitor, it blocks only about 70% of DHT, whereas dutasteride blocks essentially all type 1 and type 2 5-alpha reductase and even some type 3, therefore reducing a lot more. By contrast, total and free testosterone levels, they do not decrease. They often rise modestly, approximately plus 10 to 20% on average, due to less conversion to DHT. So, in sum, DHT goes down about 90 to 98%, testosterone goes up modestly, 10 to 20% relative to baseline. But androgenic environment is in a net reduction driven by DHT loss because DHT is an androgen which is a lot more potent than testosterone. So let's say we have average high testosterone but near zero DHT, the androgen signaling is still substantially blunted on dutasteride. Now let's get an overview of oral spironolactone. Spironolactone is a steroidal anti-androgen with two main effects. It antagonizes the androgen receptor and reduces androgen synthesis. In vivo, spironolactone's potency at AR is modest. For example, in binding assays, spironolactone itself has only about 50 to 60% of DHT's AR affinity, so it's weaker than DHT, right? Thus, spironolactone is often described as a relatively weak AR antagonist. Clinically, spironolactone's anti-androgenic effects are dose-dependent and usually require higher doses. For example, women with hirsutism typically need 100 to 200 milligrams a day to see full effects. However, today we're mostly going to be looking into lower doses of spironolactone because, as mentioned, the risk-reward ratio needs to be adequate enough. In practice, AR blockade at the doses that we're looking at, which are 50 to 100 milligrams a day, AR blockade is partial, of course. Based on available data, at 50 milligrams a day, few studies report strong effects. We estimate maybe about 20 to 30% of AR blockade in target tissues. But at 100 milligrams a day, of course, AR blockade is more substantial. For example, women on 100 milligrams a day showed about a 20% reduction in body hair shaft diameter and 30% at 200 milligrams. This implies that roughly about 30 to 50% of AR signaling may be blocked at 100 milligrams a day of oral spironolactone, although full blockade is not reached until doses of 150 and 200 milligrams a day, which is totally fine. We don't need a full blockade, and we don't even need a almost full blockade. 30 to 50% is perfectly fine and more than enough. So, thus, estimated AR blockade by tissue at 100 milligrams a day might be on the order of 1/3 to 1/2, with lower estimates at 50 milligrams, of course. Yes, these are rough estimates, but they reflect that spironolactone's anti-androgen action is significant but not complete at the doses considered, which we don't need. We don't need complete blockade. So importantly, spironolactone's effect is similar across androgen-sensitive tissues, scalp, skin, body hair, since AR affinity is the same systemically. So overall, spironolactone blunts androgen signaling but does not eliminate it at low doses. Combined androgenic effects on target tissues. Let's first look into scalp, and the condition is androgenetic alopecia. So dutasteride plus spironolactone, they target scalp follicles on two fronts, right? Dutasteride virtually abolishes follicular DHT, which is the principal androgen drive in male pattern baldness. And spironolactone adds AR antagonism within the follicle. Together, androgenic stimulation of scalp follicles would drop dramatically. Clinically, dutasteride alone is proven to halt and often reverse AGA in men very effectively, and adding spironolactone, it will provide additional benefit, but controlled data is just lacking on this. There are unfortunately no male studies on this. or even female studies on this combination. But yeah, in some, the combination should markedly reduce the androgenic miniaturization of follicles, potentially improving scalp hair density over months. I would say that even potentially it will improve almost certainly. Um, Body hair density, right? Androgens, they stimulate body and facial hair, and reducing DHT by 90% and blocking some androgen receptors, it means dampened growth of androgen-dependent body hair. One would expect existing coarse body hair to grow more slowly and possibly thin out. Indeed, yes, women on spironolactone, they report slowed growth and reduced coarseness of body hair. Unfortunately, we don't have such studies on males. But similar, although lesser effects could occur in men. It's written lesser here in my paper, but what I meant by that is that, of course, like a hairy male, right, an averagely or even more than average hairy male, I mean, he won't go down to female levels of body hair, which is like uh, very, very little. But the net reduction will be, I think, even greater than that. So uh, the visible net reduction in the body hair, it will, yeah, a lot more hairs will be thinned out, right? And it will just visually look like a lot more rapid, like not rapid, but the contrast would be a lot greater than that of a woman's condition, right? On the same dose. That's what I think, at least. So, yeah, combined with virtually no DHT, male body hair should be notably reduced. We estimate body hair density would fall significantly, perhaps roughly like halving, so down 50% of coarse hair signal, and the exact change, of course, is unknown. This is all just speculation on the available data, but that's what I think, at least. So acne and sebum, so skin effects. Acne vulgaris and seborrheic dermatitis, they are driven by androgens in sebaceous glands, which predominantly use 5-alpha reductase type 1, which is thankfully blocked by dutasteride really potently. So by cutting DHT levels and blocking AR, this regimen should significantly improve hormonal acne and reduce sebum production. Spironolactone alone is highly effective for acne in women. It's been, I mean, there are multiple trials on this, right? It's been clinically proven. So in men, similar improvement is expected, right? Sebum excretion and lesion counts should drop. There are a lot of anecdotes online, and even dutasteride alone can modestly reduce scalp sebum, but spironolactone will amplify this effect. Seborrheic dermatitis, which correlates with sebum and androgens, would likely improve as well. In practice, one would anticipate marked clearing of acne lesions and scaling after a few months on the combination. So let's talk about something that I call androgenic load, which is, I don't know, it's a term that I just use to describe the overall androgenic effects, the strength of the androgenic effect on the body, right throughout the body. So one way to conceptualize the impact of the combination is to compare a hypothetical androgenic load score. So imagine a young adult male with very high androgen activity, scored as 8 out of 10 on this androgenic load score scale, right? So he has high DHT, right, because he's young, he has a lot of hormones, his AR is active, so he has acne, he's experiencing hair miniaturization, hair loss, right? He has a lot of body hair, and yeah, so after adding dutasteride 0.5 milligrams plus spironolactone 100 milligrams, systemic DHT is 90 to 98% cut, and AR is partially blocked about 30 to 50%. The net androgenic stimulation might thus drop to roughly 3 to 4 out of 10. So, I mean, in this scenario, testosterone remains normal high, but without DHT and with AR partially blocked, the functional androgen signal is greatly reduced. Visualizing this, scalp follicles and skin glands would behave as if under a much milder androgenic drive. So miniaturization will slow dramatically and even reverse, and sebum-driven conditions would ease. So, side effects and risk, right? Let's talk about that briefly. Spironolactone's anti-androgenic side effects are dose-dependent. Key concerns in men include, of course, gynecomastia, erectile dysfunction, libido. Hyperkalemia is also one that's connected more to spironolactone's diuretic properties. So let's talk about that. So gynecomastia, right? At 50 milligrams a day, a chance is about 5 to 10%. At 100 milligrams a day, it's more, 10 to 30%. So yes, of course, it's high. But what we should note is that up to 2/3 of men are either experiencing or have experienced or will experience gynecomastia in their life. It's really common, and it's not like you just grow big breasts right out of nowhere on spironolactone. You might experience some breast tenderness, some breast pain, and you might experience some glandular tissue developing. The chances of that are up to 30%, right? So you have to weigh the risk-reward ratio, but it's not that, I don't know, it's not that dramatic and scary as everyone likes to think, right? So erectile dysfunction, it's rare. The libido lowering is also rare at 50 milligrams a day, but on 100 milligrams a day, it's up to about 10%. So it can happen. Also remember that it's a spectrum. So you can, I mean, it's not like you either have it or don't have it at all. It's like noticeably, it's up to 10% on 100 milligrams a day, right? Hyperkalemia, since spironolactone is a potassium-sparing diuretic, so it flushes out sodium and like some other minerals, and but it spares potassium in the body. If you're on a high potassium diet, like extremely high potassium diet, I would recommend like just reduce your potassium intake. But overall, it shouldn't be a problem. It's really rare, even on 100 milligrams a day. It's like less than 5%, and yeah, it's easily mitigated by just changing your diet a bit if you're consuming, I don't know, giant levels of potassium. Also, as a side effect of spironolactone, it makes you, like, due to lowering the sodium to potassium ratio in the body, you can Google more on that, research more on that. It's also really interesting. It reduces the bloating, so you will, yeah, I mean, most people, I would say, would be really satisfied with seeing their body and face mostly also just slimmed out, and yeah, just they look a lot more chiseled, right? So, conclusions. Let's get to conclusions. So combined dutasteride 0.5 milligrams a day plus spironolactone 50 to 100 milligrams a day would be expected to dramatically reduce androgenic stimulation of scalp, skin, and body hair. Dutasteride alone cuts serum and tissue DHT by about 90 to 98%, while spironolactone adds partial AR antagonism, roughly 30 to 50% blockade at 100 milligrams. The net effect should be significant slowing or reversal of male pattern baldness, thinning of body hair, and clearance of hormonal acne and seborrheic dermatitis, approaching a 60 to 70% reduction in net androgenic drive. However, side effects rise with spironolactone dose. At 100 milligrams a day, modest gynecomastia, up to 30% of men, and possible libido decrease can occur. Lower doses, 50 milligrams, carry far less risk. So, yeah, what I would probably advise is to start with dutasteride 0.5 milligrams daily, with spironolactone 50 to 75 milligrams daily, probably 50, right? And then increase only if needed, but I wouldn't go further up than 100 milligrams a day. I think that more than that is too much, right? It's but I mean, of course, everyone is individual. Everyone is they think for themselves, right? So, yeah. In summary, although no large male trials exist, extrapolation from human studies suggests that this regimen would, in very simple words, turn the dial down on androgens from about 8 out of 10 to a 3 out of 10, for example, right? Yielding appreciable clinical improvements in all the androgen-related conditions. I believe personally that spironolactone is significantly underrated as a therapeutic option for males struggling with androgen-related issues like hair loss, hormonal acne, excessive body hair, and oily skin. There's a widespread perception that blocking androgen receptors in men is inherently dangerous or inevitably feminizing, but that view is overly simplistic and fails to account for the nuanced ways the body responds to hormonal modulation. While it's true that spironolactone can have feminizing effects at high doses or in sensitive individuals, this doesn't mean it should be dismissed outright. With careful dosing and perhaps a gradual titration approach, it's entirely possible to strike a balance where one can achieve significant anti-androgenic benefits, such as reduced scalp DHT activity, sebum production, and hair follicle miniaturization, without triggering undesirable side effects like gynecomastia or sexual dysfunction. Moreover, androgen sensitivity varies greatly from person to person, so when a highly androgen-sensitive male starts a combination of dutasteride and spironolactone, he will basically end up mimicking systemic androgen sensitivity of just another male who was just born like this and has no issues living his life. So the one-size-fits-all view of male hormonal treatment is outdated. Individualized regimens informed by testing and symptom tracking, they open the door to effective and safe use of medications like spironolactone, even in male patients, especially those suffering from high systemic androgen sensitivity. That's all for today. Thank you for watching and listening, and yeah, have a great day.